My name is Maruka Jole, and I'm a dentist working with Yeko Dental Medical Center Chavakuza. Today, we are here to talk about the signs or features of a dry mouth, stroke xerostomia. How do you know that I have a dry mouth? And dry mouth doesn't mean the amount of saliva. It's the amount of the saliva you have in the mouth. So if you have little saliva or no saliva, it means that you have a dry mouth. So how do you know that I personally have dry mouth? Those are the signs, stroke the features of xerostomia or dry mouth. So how will you know? One thing, one of the signs which identify that I may have a dry mouth is dental caries. If you have dental caries in your mouth, or you have a lot of dental caries, it's one of the signs that you have a dry mouth. You know, the saliva plays a very big role in reducing dental caries in our mouth. How? This dental the saliva contains what we call it contains a substance, neutralizing substance, which neutralizes the acid which demineralizes the tooth or the enamel of the tooth. What does it mean? So if you have saliva in your mouth, your saliva can reduce the amount of acid in the mouth. So it means that dental caries will be minimal. Then another thing is periodontal disease, gum disease. If you have a lot of gum disease, it means that you may likely to be with little saliva or xerostomia or dry mouth. So saliva plays a very big role. Then another thing is you have fragile mucosa. Burning fragile mucosa. Your mucosa or the lining in your mouth may have a burning sensation. Those are one of the indicators that you have a dry mouth. Another thing is we talked about dental caries. We talked about dental caries. We talked about periodontal disease. We talked about fragile mucosa. Then another thing is many people have lost their teeth and they have artificial teeth. One of the artificial teeth they are having is the dentures. If you have a little saliva in your mouth, the denture in your mouth can't fit. You know, the saliva plays a very big important. It's important while fixing the dentures in the mouth. What does it mean? That this saliva helps us to fit the denture in the mouth, to fix it. So if you don't have saliva, your denture can't fix. Your denture can't fix. You may have your denture may fall down. Doesn't fix. Reason is you have little or no saliva to fix the denture. Another thing, you may have oral infection. There are very many. Your mouth may have oral infection. So if you have saliva, it means that you may have reduced oral infection. Then another thing, you may have difficulty in eating. For example, eating cake, biscuit, that dry food. You have difficulty in eating cake, eating biscuit. Why? Because you don't have saliva to soft this food. I think we are very together about that. Now, how do we manage How do we manage this dry mouth condition or the xerostomia? One, you need to identify the cause. What is really the cause of this dry mouth? You need to identify the cause. When you identify the cause, it means that you can easily address that problem. If you identify that cause, you can easily manage the problem. Another thing is, we assure these people of ours, the one we stay with, the one with this problem, we need to reassure them. You encourage them. This problem can be worked upon, but people may lose interest, may feel heartbroken. So what does it mean? We need to reassure these patients of ours. We need to reassure these people we stay with this problem. Another thing, we need to rehydrate these people. If you are not taking enough water, you need to take enough water. You need to take enough water. People with xerostomia, people with dry mouth, you need to move with water. You need to take a lot of water. Because this body, if this body doesn't have enough water, it means that you have the problem with the dry mouth. This thing is very common. For example, when you are fasting. When you are fasting, it means that you don't have enough water in your belly. You may have dry mouth, may have your lips breaking. Those things. Another thing is avoid these drugs which causes dry mouth. Avoid them unless if you can't stay without them. There are some drugs, they have that effect. They may cause reduction of saliva production in your body or by your salivary gland. What does it mean? If you don't have any problem, if there is no reason why you are taking drugs, please stop them. Please stop them. I think I'm very clear on that. Then another thing, if the problem is organic, for example, it's brought by the difficulty in an organ in your body, please go and see a dentist. Go and see a medical personnel to address that problem. I think I'm very clear. Thank you so much for watching our video. Don't forget to subscribe. Don't forget to share the video. Don't forget to like our video. Thank you so much. This I've been Maruka Jole, a dentist at Shabakuza. Have a nice day.